Coming up next on Being Well, we'll be talking respiratory infections such as influenza, bronchitis, and pneumonia. Our guest is Dr. Sheila Baker, Medical Director at the Eastern Illinois University Health Service. Dr. Baker will be here to talk about prevention, treatment options, and more. That's just ahead on Being Well, so don't go away. Dr. Baker, Sheila, thank you for coming on the show. We're talking about respiratory infections.
Yes.
How do we get them in the first place? Because it's something we've all had at one time or another.
Yes, we all have had respiratory infections, and we get respiratory infections by transmission. Well, how do these organisms how are these organisms able to be transmitted? Really about three ways: aerosol, I cough, I sneeze; droplets, so the drops fall onto something; or direct hand-to-hand contact with someone who's already infected.
Okay, so respiratory indicates that it's, where do the infections occur? I think it's pretty obvious, but.
Well, there's the large term respiratory tract infections. The respiratory tract involves the organs or areas of the body that help us to bring oxygen into the body and help us to remove carbon dioxide from the body. In the upper respiratory area, we think of the nose, sinuses, throat, larynx, trachea, and the bronchi. Lower respiratory tract infections really refer to the lung tissue, the lungs, and those infections we commonly call pneumonia.
Okay, so it sounds like the lower respiratory infections can actually be a little more severe.
Yes, lower respiratory tract infections are usually more severe because it's impairing oxygen transmission. So again, we can't bring oxygen into the body. That's going to be more serious. And many times those infections are caused by bacteria, which in many cases can be more serious.
Okay, that was my next question. There seems to be some confusion over what's a bacterial infection and what's a viral infection. Can you clear that up?
Well, yeah, I certainly can. Let's back up. The majority of respiratory tract infections are upper respiratory tract infections,
Which would be cold.
The most common ailment that we all experience is the common cold.
Yes.
And that generally affects the upper respiratory area. So the nose, the back of the throat, the bronchi.
Okay.
And that's more common and usually less serious and a self-limited infection.
Okay, so I kind of interrupted you there. So let's talk about this bacterial versus viral thing.
Bacteria and viruses are different organisms. They look different and they respond differently. Bacteria have material, capsules, genetic material that we can actually produce medications for that then we can stop the bacteria from multiplying or actually kill the bacteria. Viruses are generally smaller organisms. They don't have as much genetic material on their own. They can't survive as well on their own, and so it's much more difficult for us to produce or find treatments, medications that will actually kill or stop the virus. Again, there are a few antiviral medications, but they don't kill viruses like antibiotics can kill bacteria.
Right. So are things like the flu, bronchitis, cold, those are viral, correct?
The majority of colds are caused by viruses. Over 90% of colds are caused by viruses. Bronchitis is almost always a viral infection as well. Less than 10% of bronchitis is caused by bacteria, which kind of brings up that point. Then why do we prescribe antibiotics for something that's generally viral? And we really shouldn't.
Right.
And people really shouldn't ask for antibiotics. Now, influenza, you mentioned that, is kind of its own specific virus. Influenza virus is a very serious infection. It runs through the world every year, generally in the northern hemisphere in the colder months, but it can cause a lot of problems, and we actually do have prevention for that, the flu vaccine, and we do have some anti-flu medication for that as well.
Okay, so taking an antibiotic for a virus is not going to do you any good.
It's not going to do you any good. And we have studies that show that it never shortens the transmission, it never lessens the symptoms, it does not help.
And then you can have the problem of antibiotic resistant, which creates a whole other set of problems.
Exactly. In the last 2 to 3 decades, we have seen antibiotics that were commonly used to treat and were very effective against bacterial infections now becoming ineffective because bacteria learn how to become resistant, and then those bacteria can actually share that information with other bacteria. So it's a huge problem. We now have fewer helpful or effective antibiotics when we actually need them for specific bacterial infections.
That's kind of frightening.
It should
very,
be.
very frightening.
It should be very frightening. However, most people, when they are sick, I just want a pill to make me feel better. And we know that antibiotics can be so effective against bacteria, we kind of hope that they're going to help for those common ailments, those viral infections.
So if you're suffering from, let's talk about the flu. Let's start with a cold.
Okay.
How long does it typically take to get over a cold, and at what point do you go, I've got something more serious?
A common cold usually lasts 1 to 2 weeks.
Which seems like an eternity.
Which seems, yes, when your nose is plugged, when you're coughing, you've got a low-grade fever, it seems like forever, but it lasts for 1 to 2 weeks. It's going to be self-limited. You can take medications to help with symptoms, but it's going to then, eventually that virus doesn't have a longer lifespan, it's going to die out, you're going to get better. Antibiotics are never indicated for the first 10 days or so of a common cold. However, bacteria can superimpose infections or become secondary infections, and at times, with a provider's, history and physical provider may at times determine that a bacterial infection is now present. Infection that's localized and caused an ear infection, localized sinus pain, showing us that now it's into the sinuses. Those type of infections then would be candidates for antibiotics.
Right.
So generally, let the cold or the upper respiratory tract infection run its course. I develop some secondary symptoms, ear pain, sinus pain, or maybe I develop a secondary fever when I hadn't had a fever for several days. Those would be reasons for you to seek professional opinion and see if maybe antibiotics are indicated. And also at times, especially for children, young people, we might do some specific testing, cultures, rapid tests to see if bacteria is actually present.
Okay. Bronchitis, the flu, is that typically the same amount of time it takes to get over, kind of that week to 10 days, or?
Influenza it really wipes people out, and influenza can cause much more severe symptoms. So the mild to moderate tiredness, fatigue is really more moderate to severe.
Yeah.
People complain, but they're still at work, they're still doing their activities with the cold. People are in bed with the flu. And it can still last 1 to 2 weeks, but the symptoms are much worse. And then people with influenza actually do run more of a risk of getting like a secondary pneumonia, which then obviously is a lot more severe, requiring more treatment.
So some of these things can start off as something simple and then can lead to other things.
Exactly.
Okay.
And it really just depends on how sick you are, your immune system, what else you get exposed to while you're sick.
That's right. So let's talk about something a little more severe, and that's pneumonia. How do you know if you have that? I mean, what are some of the telltale symptoms of pneumonia?
Shortness of breath. I can't catch my breath. The constant cough. And many times pneumonia will feel localized. You'll have a specific pain when I breathe in, when I cough. It's not that soreness from all those muscles, coughing and things such as that, but it's really a specific pain. And people will find that, with the cold, I may feel like I can't breathe because my nose is clogged, but now I can't walk down the hall. I can't go up the flight of stairs. So really, shortness of breath, can't catch my breath, constant coughing, and some pain.
Because is pneumonia, what exactly is that? Is that fluid in your lungs?
Well, because of the infection, yes, the infection or the bacteria, virus is there, all these different factors that go in to try to clear up the lungs, start to take up space. You get inflammation, so the airways are now narrowed, you've got mucus production, and it really then just kind of blocks off or shuts down a portion of the lung.
Okay. I have a question. Are things like strep throat, does that fall into this respiratory infection?
It still is
Okay.
because it's a throat, whether you call it pharyngitis or tonsillitis, and it is.
Okay.
We see bacterial infections in the tonsils more common in children. And fortunately, we do have the rapid tests and throat cultures, which are fairly inexpensive, that can help us to diagnose. And there's also some strep scores that we can use where
Okay.
doctors ask a specific set of questions to see if it kind of rules in a bacterial strep infection versus rules it out, more common.
Okay.
And those infections should be treated with appropriate antibiotics.
So strep is a bacterial infection.
Strep throat group A, beta hemolytic strep, is a specific bacteria, affects the tonsils, and really the importance for that, although we think of it as a throat pain issue, has to do with the fact that it can cause secondary complications to the heart, kidneys,
Okay.
other things.
What about mono? What is that?
I think mono is the college student's
Yeah.
friend. Mono is also, it falls into the respiratory tract infection category. However, it causes other symptoms as well. So yes, people who come down with this infection will have the cold symptoms, usually a pretty serious sore throat. If they have tonsils, which it is more common with those with tonsils, the tonsils are going to be large, exudated. There's going to be pus or mucus on them. They're going to have trouble swallowing. But also, it affects the lymph system, the lymphatic system,
Okay.
our glands.
Yeah, so you have really
And so we have
sore
large
glands.
swollen glands that we notice in our neck specifically, but that can enlarge anywhere in the body, and it can also affect the spleen and liver. So it has complications that make it important, just like strep does in a bacteria.
Why is that more? You said you're the medical director here at Eastern, so your clientele are our college students. Why is that more prevalent in kind of that age and younger, and why don't people our age get it as much?
Well, probably immune system issues, and that has to do with lifestyle issues. So although I don't know every reason why college students tend to get mono, we do know, though, it's more common in adolescents and young adults as opposed to the other ends of the spectrum. But probably because they share things. Students on a college campus, for example, they share the same living space, learning space, playing space. They do everything together. Well, suddenly then we're taking sips out of the same glass. We're putting all of our hands in the same popcorn bowl, and we just tend to pass those secretions around. And then, maybe they're not getting enough rest. They're not eating as well as they should, and suddenly. Like I said, it seems like college students don't like it, but mono likes college students, so it's the friend of the college student, and we see a lot of it.
And
on
I'm
college
guessing,
campuses.
in school-age kids, you see, if a few students get flu, it tends to go around. I mean, there have been schools that have closed down because there's so many kids that are
Yes,
sick.
once it hits, I guess everybody knows it's coming. We're all toast. We're all going to get it. So you just bunker down and wait for it to kind of hit you and then pass.
So a lot of these respiratory infections, for people who are, sort of in the middle age group, relatively healthy, we can get over it. But certain populations, the very young, the very old, this can be really severe. Talk
Exactly.
about an issue called RSV, which is something that young children get. And what is it, and why is that such a concern for parents?
Well, like we'd already said, bacterial infections typically are more severe, but a couple viruses tend to be very notable for the disease and the problems they can cause. And RSV is just an abbreviation for a virus called Respiratory Syncytial virus. This virus can cause almost asthma-like symptoms in a very short period of time in young children, age 2 and younger, and the very young, premature infants. It's a very serious respiratory infection. Yes, the rest of us can get it, but our immune systems were developed. The way we can now respond to infection, the way our immune system is developed, makes it less of a serious infection, but can cause what we would call bronchiolitis. The entire bronchial system is infected, lots of mucus, coughing, wheezing, just a real serious infection. And unfortunately, because it's virus, there is no antibiotic, so it's just supportive care. And you've got children who can't breathe, they don't know how to clear their lungs, they don't know how to blow their nose. It's a really serious infection and can actually cause complications for months to years later in young children.
Okay, and let's talk about the elderly population, because you do hear of people dying from pneumonia.
Yeah, on average, somewhere between 36 to 40,000 people die every year in the United States from influenza. In epidemic years or years where the shift or the change of the virus didn't quite match the vaccine, we can have even more deaths. But our immune systems play a big role in that. So as we get older, just like as we're young, our immune systems are less able to help us out. And then unfortunately, as we age, we don't just have our immune system to deal with, we develop other conditions. Diabetes, heart disease, lung disease, COPD. We see more, obviously, kidney disease, liver disease, and all of those things make it less likely for us to be able to fight off infections. And so that the virus affects us, but then we may even get a secondary infection on top of that.
So we're not necessarily, well, everyone, you're going to get a cold this year. There are a cold or flu or whatever. There are some preventative things that we can do to hopefully stave off some of this. What are some easy things that we can do to make sure we're not, hopefully not getting sick?
Well, the best thing to do is to take care of yourself. Get proper nutrition, proper exercise, proper rest. Wash your hands before and after contact with other people. If you can't wash your hands, use hand sanitizer. Don't share things with other people. Don't share eating utensils, drinking utensils. Don't use bathroom items that might accumulate body fluids and things such as that. Avoid contact. You see somebody ill, tell your friends you'll meet them for dinner in a week or two, but avoid contact with ill people.
Well, and I think in a workplace, you know, a lot of times we, oh, I've got to be here, I've got to get this done. Well, believe me, the rest of us would like for you to stay home.
Yes, here's a little public service announcement. The rest of us don't want this.
Yeah, if you're sick, stay home. Because, you know, here at WEIU, you know, there's 20 of us. Boy, it does go around because we share a lot of the same workspace, computers. We're just in close contact.
Exactly. I mean, you know, in the olden days we paid with cash, but nowadays we all use the same PIN as we sign our little credit and debit cards in all the shopping venues and things.
Well, there is another way to prevent things like flu, and that is with the shot. And I have agreed. I have not got my flu shot, and Sheila has agreed to give me a flu shot.
Yeah, let me talk a little bit about that specifically. The flu shot is actually available and is recommended to all Americans once you're 6 months of age or older every year. So the CDC and the ACIP, the Advisory Committee on Immunization Practices, recommends that all Americans get a flu shot every year. Because viruses change and shift, you're never going to develop immunity to every flu strain. So get it every year. There are a few people who might not be indicated to get that. Like I said, if you're younger than 6 months, also if you have some severe egg allergies, although now that's even being disputed, and then a few people who've had conditions like Guillain-Barré, which is a very rare kind of neuromuscular condition. They shouldn't get it, but for the rest of us, we should all get a flu shot every year.
Okay, well, we've got some supplies here. We're going to get ready.
Yes, we do. So I'm going to get my hands sanitized.
I'm going to pick up the, this is the container.
Yes, that's our sharp container so that we don't have any needle sticks during this process.
And I'm going to show that it really doesn't hurt. It's not, you know, it's pretty painless. So
I'm sure you're going to do fine.
Thank you.
Now, before we give anyone a flu shot, we do have them read the vaccine information sheets,
which I did before
which I can attest that Lori did her homework, and she has to sign a consent stating that we've talked about any contraindications and that she agrees to that, and she's done that as well. And now I'm going to get all my little supplies here.
Okay.
Get it all ready. The nurses at Health Service were so nice to get this all ready for us today, so thank you, nurses. Jamie, thank you for getting this ready for us today. And I'm going to get this ready, and we're going to give Lori her flu shot, and she's going to be safe from the flu.
You do have sometimes a little bit of arm pain.
Yeah.
It's not that bad.
The majority of us will feel a little achy in our arm, and many times, now for the camera, we're going to do this in your left arm, but many times we'll actually do it in your dominant arm because that you're going to use that arm a little bit more. And,
I'm not even going to look.
Yeah, don't look. Here we go.
It didn't hurt. There you go. Put that away. There you go.
we go.
All right.
I'll give you a little Band-Aid.
Okay. This is a first on our show.
There you go. Well, we'll just have to come every year now and make certain that Lori gets her flu shot. So she is a healthy, safe person.
And there are other shots that I know pertussis is one when you drive by Walgreens or the pharmacies. There's a sign, get the pertussis. That's whooping cough. That's indicated for whom?
Actually, now for everyone.
Okay.
Of course, children need to get their initial series against whooping cough. It's included in the vaccine we call DPT, diphtheria, tetanus, and pertussis. But now, because we have found that pertussis titers wane in our system, all Americans, once you turn 19 through age 65, should at least have one booster of a vaccine called Tdap, which is now not just our tetanus shots that we are supposed to get every 10 years, but it includes now pertussis again, so that we will boost that immunity, so that hopefully we can kind of stop this epidemic of whooping cough that's going through our country.
Is whooping cough viral or bacterial?
Whooping cough is bacteria.
Okay, so that's pretty severe.
Yes.
Okay.
And again, it's one of those infections that is worse in young people, in children, but can cause coughing for a long period of time in adults as well. An old name for it was the 100-day cough.
Oh boy, well, we don't want that.
No, we don't need that.
Well, Dr. Baker, thank you so much for coming on the show and sharing this information and for getting me my flu shot. So I hopefully won't be sick this year.
No, call me.
All right, I will.
All right.
Thanks, Sheila.
You're welcome.